day and welcome to an episode of Debunking the Myth, the program where we really speak about COVID-19 and all the myths that you've heard about COVID-19. I mean, over the past few weeks, COVID-19 has changed the likelihood of our lives, and with the misinformation going on social media, it's important for us to demystify the myths and speak about the facts. On today's program, we're joined by Professor Jeffrey Mphahlele, who's from the Medical Research Council. Prof, good day.
Good day to you, and good day to your participants as well.
The past few weeks have been life-changing, to say the least, for a lot of us. I'm sitting at home, working from home, and I'm not the only one. How has the past few weeks been like for you as a medical expert?
It's the same because we are all working from home, unless you are an essential service provider. We are at the South African Medical Research Council, but there are those of us like me who can work from home. So I chose to work from home. So the past few weeks have been really a learning experience for most of us because we had to readjust our lives, working from home full time, not just half a day or a few days, and you know that at some point you can dash and go to the office. So like you, it's been an experience.
We have invited our Facebook audience to join us in terms of speaking of the COVID-19. And I'm joined by Enoch, Enoch, briefly introduce yourself to the professor and tell us where you're from.
Thank you. Well, I'm Enoch. I'm from Verulam, along Phoenix side. I'm working as a truck driver.
So, Enoch, you had a question for the professor. Just briefly take us through your question.
My question is relating to why is it the number is keeping rising while we are on national lockdown?
No problem. Thank you very much for giving me the opportunity to engage your questions. The main reason why we have got increase in number of infections could be because of introduction of mass screening in the communities. You have seen the last few days that there are a number of healthcare workers going into different communities across the country and screening people for COVID-related symptoms, and also taking swabs so that those who have got COVID-related symptoms or those who have got contacts with confirmed cases can be screened. And we have also seen that the number of cases that are detected by the laboratories in the last few days since the introduction of mass screening, the cases have increased tremendously. And I think part of this is because of introduction of mass screening. But the other reason that I would like to put forward is that we have seen that not everybody is actually observing the regulations for the lockdown period. And obviously, if you don't observe the regulations, you are still mingling in groups, and this will increase, the cases because the regulations are meant to discourage people not to be in groups, to avoid infections spreading in these groups. So that this could be some of the reasons why in South Africa we are seeing more cases reported. This is not unique to South Africa. A number of countries throughout the world have introduced lockdowns, but that did not stop new cases coming through, because it depends on when you actually introduce this lockdown. If you introduce the lockdown when the virus has already entered the community and is spreading through community, the lockdown will reduce infections, but will not going to stop infections from occurring completely.
Now, Prof, you speak about numbers, and I'd like to bring you now to a question very close to Lee's heart. Lee wanted to ask a very specific question. This relates to the cruise ships and how COVID-19 was in the cruise ships. Lee, go ahead, ask your question.
Good day, Professor. My name is Lee Meyering. So I came across something that boggled my mind. If this is an infection that maybe originated from an animal or somewhere, that it just boggles my mind when it comes to your if we look at your let's say sea infections, your COVID-19 on your sea or sea conditions. We're looking at your air, moist air. We're looking at different types of climate on sea. So that actually says that due to the cruise ships going from point A to point B, it means that there's is also a fact that we maybe could looking at the technology of 5G because of if you look at most of your Luxliner or your cruise ships or your Luxliner cruise ships, they are all equipped with 5G technology. And so on that question, with your 5G infections on land and your 5G infections or your COVID-19 infections on land and your COVID-19 infections on sea, almost hapless simultaneously. Is this due to the COVID or let's say the 5G technology being rolled out? And is COVID-19, like the word says, COVID, it sounds like a COVID operation, which sounds like a cover-up operation to misdirect or mislead people into what it actually is?
Okay, no, thank you very much, Lee. All these questions are extremely important because it is important for people to understand how you get infected and how scientists make a link with the origin of the virus. If we say the origin of the virus could be from animals or is most likely from animals, what is the basis for that? So maybe just quickly, giving you direct answers to some of the things that you raised. So COVID-19 does not necessarily mean, COVID operation. So COVID is like an acronym from coronavirus, right? So coronavirus disease that is discovered in 2019. So abbreviated COVID-19. All right. So it's got nothing to do with, COVID operation. Then the next thing that you alluded to is whether there is any link between infection and the technology like the 5G. Clearly not. This is just a myth.
Now we know, Lee, and we know that there is no link with 5G. Is that out the park now?
We can put it on the table for now.
Okay. Now
research continues as the pandemic continues. So, like the Prof said, we're still studying the situation.
I'd like us now, Prof, to speak on the next question that Lee actually wanted answered. And Lee wanted to know about a vaccine. Lee, keep it short and let's ask the professor about a vaccine for COVID-19.
My question about vaccinations is that with all this chloroquine information, the chloroquine vaccinations, we're also looking at the Chinese saying they have a vaccination which actually combats the COVID-19 with a 96.77% efficiency, meaning that they basically sort of have a cure for it, but it's in the form of nanotechnology or let's say nanomedicine. How can we trust basically the vaccinations? Because if we're looking at nanomedicine or nanotechnology, we're looking at basically computerized systems being put into human bodies.
Okay. No, thanks, Lee. All these are really wonderful questions. But I just want to clarify one thing before I start answering your question on vaccines. I think there is a mix-up of vaccines and drugs, okay, in your question. If that is not the case, I do apologize. But that's how I, understood your question. So we do have, drugs that are being tested to treat COVID-19. At the moment, we don't have any licensed drug that has been proven to really work for COVID-19 and licensed as such.
Prof, now I'd like to bring you to another question that Enoch had, and this relates to infection and when someone is infected with the disease, with the virus. Enoch, please go ahead and ask your question.
Okay, thank you. I just want to ask about some other people are recovering without any symptoms, right? And then some other people they die. Some other people they recovering without any symptoms. And I heard that the blood of those people who are recovering without any symptoms can also treat those people who have the weak immune system in their body. Is that true? Is that true? And how come some other people are recovering without any symptoms and some other people are getting serious until they die? How it is happening?
Yes, thanks, Enoch, for the question, and is very much justified. So maybe I should start by saying that this is not unique to COVID-19 disease. There are a number of infections where people are infected and they are just unaware that they've got infection. All right. So COVID-19 is just one of many infections where you can be exposed to the virus. Then you don't even know that you have the virus. You transmit the virus to other people. Obviously, transmission is happening without your knowledge. So it's not like it's intentional because you don't know that you have got infection. And eventually your body is able to eliminate this infection completely from the body. So that happens with many infections. As far as the other question is concerned, where you wonder why some people can, it's related to the use of blood, all right, from infected individuals as therapy. This is also something which is done and done in a scientific way. So you can actually use the blood of somebody who recovered from disease as a therapy. In other words, to treat those who have got a disease, or even to prevent people from getting disease.
Wow, Prof. Now, just as a round off to this conversation, we are now in the last few days of the lockup, and I'm sure a lot of the audience out there just cannot wait to get past this period. What advice do you have for all of us in terms of dealing with COVID-19 in the next few days?
The most important advice is that we need to obey the regulations, the lockdown regulations, because if we don't do this, we actually exacerbate the problem of COVID-19 in the country. If you are infected, for example, and you don't obey the rules, you are spreading the virus to those who are not infected. Mm-hmm. And then if you are not infected and you mingle with infected person, you're posing yourself at risk of getting infected. So obeying the rules is very, very important. So the rules are very clear, and these are not just South African rules. Physical distancing, extremely important. Washing your hands as frequently as possible, extremely important. And now the other important measure is actually wearing masks. And I'm not talking about surgical masks because these masks are reserved for healthcare workers. I'm talking about cloth masks. So if you believe that you're going out for very good reasons, maybe for shopping, and you want to minimize the risk of exposure, you can wear this cloth mask So these are some of the important measures that we need to adhere to.
So there you have it, another episode where we've bust about 4 myths related to COVID-19. In as much as the conversation was very exciting, I'd like to thank Professor Jeffrey Mphahlele, who's the Vice President of the Medical Research of the South African Medical Research Council. Professor, thank you very, very much. I'd also like to thank the 2 gentlemen, Lee, and also thank Enoch for being part of this conversation. And till next time, bon voyage.